During one of my live video, one of my subscribers that was pregnant asked me to make a video on how to prevent or reduce tear during labor. That's perineum tear during labor. And I deem it fit to share it with everybody and not just with that subscriber. All right. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Messi Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you two things that are likely going to help you reduce or prevent perineal tear during labor, during childbirth. But before we go into details into this class, if you're new on our YouTube channel and these are content you're interested in, please click on the subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy saying thank you. Let's go there. All right, welcome back. You all know what I'm going to be talking about. Before I tell you how to reduce or prevent it, it is important for me to tell you the four types of tear that are likely going to take place in the perineum during labor, that's during childbirth. So there are four types of tear that are likely going to take place. The first one is known as the first degree tear. That's the first degree tear. In this tear, what happens is that just the skin is torn, just the skin, and most times it doesn't require treatment. It just heals on its own easily. Then the second degree tear, which is the second one, in this part is not just the skin that is affected, but also the muscles of the perineum. The muscles of the perineum are affected alongside with the skin. And this type of tear requires stitching, requires treatment for it to go, unlike the first degree. So the third type does not affect the perineum, the muscles alone. It goes to the anus. It goes to the muscles of the anus. The anal sphincter is being affected in a third degree. You know your anus. You know after the perineum, you have your anus. So now the tear has passed through the muscles of the perineum and it has gone to the anus. So that is the third degree. Then in fourth degree, it's not just in the muscles, it has also gotten to the lining of the anus or the bowel. So these are the 4 degree tear that are likely going to happen during childbirth. But these 2 points I'm going to give you is either going to prevent it or to reduce the tear. It's possible it was supposed to be grade 4, but because you follow these 2 steps, it might reduce it to grade 2 or grade 1. So now let me take you to the first point, which is very important, especially for first-time mothers. So the first tip I have to share with you when it comes to preventing or reducing is perineal massage. Perineal massage. This massage, immediately you clock 35 weeks pregnant, I think you should start this perineal massage. You or your partner can do it, but generally it is more convenient for your partner to do the perineum massage. So I'm going to be dropping a picture on how you position your hand. You can see that's how you position your hand to give the massage. And also you can show this picture to your partner to do it, because it's much easier for them to do it, because it's difficult for you to look down and start massaging it. So encourage and prompt your partner to help you out with the perineal massage. And when it comes to perineal massage, what is advised is that you take a warm bath before this perineal massage. So when you take a warm bath, it helps to relax your muscles. It helps to relax you generally, and also loosen the muscles around the perineal region. And also for those that have long nails, if you want to do a perineal massage, I won't advise it, because the tissues around the vaginal are very tender, and short nails is important. So if you have long nails as a lady, make sure your partner has a short nails to be able to help you to do the perineal massage, because the tissues around the vagina are very tender. Then what you need next after you have the short nail is to use your thumb. Yeah, the thumb is what you need for the perineal massage. So you just go slowly around that area. So you do it daily. It's going to help the perineum to stretch during childbirth. So perineal massage started 35 weeks, and it's also very important for first-time mom. It's very important for first-time mom. So it's going to go a long way to help. And the last thing I want to know about perineal massage is that when you get your thumb, put a lubricant, like an oil, to make it easy. So you just massage it around that area. So massage, for those that are doing spa, that are doing massage, you understand that you need a lubricant, an oil to actually moisturize that area to make the massage much easy. So if you are 35 weeks and you've not given perineal massage a try, I would advise you start it as soon as possible, because it's going to go a long way to help to prevent or reduce the amount of tear you have. So that takes me to the second point I want to share with you, and that is Kegel exercise. Kegel exercise is very important generally for ladies because it helps them to improve their sexual drive, sexual desires, and things like that. Kegel exercise in pregnancy and in delivery helps your baby to come out swiftly. It helps delivery to be much easier because it gives you control over your pelvic floor muscles. It gives you control over the contraction of your pelvic floor muscles. So when you do Kegel exercise while pregnant, it is also very important. While walking, running, jogging to exercise and prepare for the baby to come, take Kegel exercise into consideration, because Kegel exercise gives you control over the muscles down there. So these are the two tips I have to share with you. If I get any other tips, I am definitely going to share it with you. So thank you very much for staying tuned. Thank you very much for watching. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.